Every year, over 50 million surgeries are performed on people over the age of 60 in the United States alone. Some of those surgeries are life-saving miracles. They give people their independence back, their vision, their mobility, and in some cases, their very lives. But some of those surgeries, they should never have happened. Studies show that up to 1 in 5 elective surgeries performed on patients over 65 provides little to no measurable benefit, and in some cases, accelerates decline. I'm not saying this to scare you. I'm saying it because no one else is telling you this. Your surgeon is often a skilled technician, not the person who decides whether you need surgery in the first place. Today, we're going to name names. We're going to tell you the 3 surgeries that the data says older adults should think twice or 3 times about, and the 3 surgeries that are genuinely transformative and worth every recovery day. Stay with me, because this video could be the most important thing you watch this year. First, let's understand something critical. Surgery isn't just about whether a doctor can fix the problem. It's about whether your body can handle the fix. After 60, 3 things change that surgeons don't always discuss with you. Number 1, anesthesia tolerance drops. The older we get, the harder general anesthesia is for our brains. Studies from the Journal of the American Geriatric Society link repeated general anesthesia to measurable cognitive decline in adults over 65, sometimes called post-operative cognitive dysfunction. It can look a lot like sudden onset dementia. Number 2, healing slows dramatically. What takes a 35-year-old 4 weeks to recover from can take a 70-year-old 4 to 6 months, and sometimes recovery never reaches the pre-surgery baseline. Number 3, complication risks multiply. Blood clots, pneumonia, infections. The statistical risk of these complications roughly doubles after age 70 compared to a 50-year-old undergoing the same procedure. This doesn't mean don't have surgery. It means choose wisely. Let's start with what to avoid. Let's talk about spinal fusion, one of the most common surgeries performed on adults over 60. Every year, hundreds of thousands of spinal fusions are performed in the United States, and the number has grown by over 600% in the past 2 decades. But here's what the data says. For the most common reason spinal fusion is performed in older adults, degenerative disc disease and lumbar stenosis, the outcomes are often no better than physical therapy and conservative management. A landmark study published in the New England Journal of Medicine found that for spinal stenosis, non-surgical treatment produced virtually identical outcomes to fusion surgery after 2 years with 0 surgical risk. And the risks of spinal fusion in seniors? They're severe. We're talking nerve damage, paralysis risk, hardware failure requiring a second surgery, infection. And here's the brutal truth nobody tells you. Adjacent segment disease, meaning the segments above and below the fused area break down faster, often leading to even more surgery. Before agreeing to spinal fusion, ask your doctor one question. Have I exhausted physical therapy, epidural steroid injections, and pain management? The honest answer, more often than not, is no. Exception: if you have progressive neurological loss, meaning you're losing bladder control or your legs are going numb, that's a different situation. Emergency intervention may be needed. But for chronic back pain alone, think very carefully. Number 2 on our list is coronary artery bypass grafting, commonly called CABG or open heart surgery, when it's done for stable angina in patients over 65. Let me be very clear. If you are having a heart attack, or if your main left coronary artery is critically blocked, bypass surgery can absolutely save your life. This is not the situation we're talking about. We're talking about the thousands of seniors who have stable, manageable chest pain and are told they need open heart surgery to fix their coronary arteries. The COURAGE trial, one of the most important cardiovascular studies ever conducted, found that for stable coronary artery disease, optimal medical therapy alone was as effective as bypass surgery at preventing heart attacks and death over a 10-year follow-up period. Now consider the risks of open heart surgery in a 70-year-old. Stroke risk jumps to 3 to 5%. Cognitive decline is reported in up to 40% of patients in the year following bypass. Wound infections, kidney failure, prolonged ICU stays, these are not rare complications in older adults. They are tragically common. If a cardiologist recommends bypass surgery for your stable chest pain, seek a second opinion from an independent cardiologist, not one in the same practice. Ask specifically, can we try aggressive medical therapy first, including statins, beta blockers, and nitroglycerin, before opening my chest? The answer might surprise you and save you from a surgery you never needed. This one requires the most sensitivity and the most honesty. When an older adult is diagnosed with cancer, the instinct is to fight, and that instinct is completely understandable. But sometimes aggressive surgical intervention does more harm than the cancer itself. We're talking specifically about situations where a slow-growing cancer, like certain prostate cancers, some thyroid cancers, and early-stage kidney tumors, is found in a patient in their mid to late 70s or 80s with other significant health conditions. The medical concept here is called active surveillance, and it's not giving up, it's being strategic. For many slow-growing cancers, the patient will live out their natural life without the cancer ever causing symptoms, but the surgery to remove it absolutely can cause severe complications, loss of function, or death. Studies from Johns Hopkins show that in men over 75 with low to intermediate risk prostate cancer, surgery and radiation offered no survival benefit over careful monitoring while dramatically increasing rates of incontinence and impotence. Before consenting to aggressive cancer surgery, ask your oncologist what is the natural course of this cancer without surgery. What does the data show for my age group? Is active surveillance an option? A compassionate, honest surgeon will welcome that question. One who doesn't, well, that tells you something too.
Now for the good news. Let's talk about total hip replacement. And let me tell you something. If you have been told you need one and you've been putting it off, please listen carefully. Hip replacement is consistently ranked as one of the most cost-effective, life-improving surgeries in all of medicine, regardless of age. Multiple studies, including a landmark review in The Lancet, confirm that patients in their 70s and 80s who undergo hip replacement experience dramatic improvements in pain, mobility, and quality of life, and the vast majority return to independence. Hip fractures from severe arthritis or falls with a compromised joint are among the leading causes of death in adults over 70. People who suffer a hip fracture and don't get it repaired have a one-year mortality rate of 20 to 30%. That's not a typo. Modern, minimally invasive hip replacement techniques have dramatically reduced recovery time. Many seniors are walking within 24 hours of surgery. Within 6 weeks, most are back to doing things they haven't done in years: gardening, walking the dog, playing with grandchildren. The surgery takes about 90 minutes. The prosthetics last 20 to 30 years. If you have severe hip arthritis that is significantly limiting your daily life, this surgery is not optional, it's essential. Here's a surgery that millions of seniors avoid out of fear, and it's costing them dearly. Cataract surgery is arguably the safest, most effective procedure in all of ophthalmology. And yet, many older adults live with severely impaired vision for years, telling themselves they'll manage. Cataracts, the clouding of the eye's natural lens, affect over 24 million Americans over the age of 40, and by age 80, more than half of all Americans either have a cataract or have had cataract surgery. Here's what untreated cataracts do to seniors. They increase the risk of falls and fractures by up to 60%. They contribute to depression, social isolation, and loss of driving independence. They accelerate cognitive decline by cutting the brain off from its most important sensory input. And the surgery? It takes roughly 10 to 15 minutes per eye. It's done under local anesthesia, no general anesthesia needed. Most patients see dramatic improvement within 24 hours. The complication rate for cataract surgery is less than 1% in experienced hands. A study from the JAMA Ophthalmology Journal found that cataract surgery reduced the risk of car accidents in seniors by 13% and reduced the risk of hip fractures by 16% in the year following surgery. If your eye doctor has told you your cataracts are surgical, meaning they are affecting your vision enough to warrant intervention, please do not wait. This surgery is a gift. Our final must-have surgery is one that often gets dismissed as not urgent until it becomes a medical emergency. Hernia repair, especially inguinal hernias in older men and ventral hernias in post-surgical seniors, is a surgery that rewards action and punishes delay. A hernia occurs when internal tissue, usually part of the intestine, pushes through a weak spot in the surrounding muscle or connective tissue. It can feel like a dull ache, a bulge you can push back in, or sometimes nothing at all. Here's the danger. About 10 to 15% of untreated hernias in seniors will eventually become incarcerated, meaning the tissue gets trapped, and incarcerated hernias can become strangulated, meaning the blood supply to that tissue is cut off. This is a life-threatening emergency requiring immediate surgery under far worse conditions. Emergency hernia surgery in a 70-year-old carries roughly 8 times the mortality risk of an elective repair done when you're in good health and prepared. Modern laparoscopic hernia repair, done through tiny keyhole incisions, has dramatically improved outcomes for seniors. Recovery time is typically 1 to 2 weeks, pain is minimal, and the long-term success rate with mesh repair is over 95%. If you've been told you have a hernia and you've been sitting on that information, please schedule your consultation. Elective today is always better than emergency tomorrow. Before we wrap up, I want to give you the 5 questions every senior should ask before agreeing to any surgery. Write these down. 1. What happens if I don't have this surgery? Make the surgeon walk you through the natural course of your condition without intervention. 2. What are the non-surgical alternatives and have we tried them? Many surgeons will answer honestly. If they dismiss this question entirely, seek another opinion. 3. What is the realistic recovery for someone my age with my health conditions? Not the best-case scenario, the realistic one. 4. How many times have you performed this surgery and what are your personal complication rates? A skilled, ethical surgeon will answer this with pride. Volume and outcomes matter enormously. 5. Can I speak to a patient of yours who is my age and had this same procedure? Patient perspective is invaluable, and most good surgeons can facilitate this. You are the CEO of your own health. Doctors are your advisors. Excellent advisors, but you make the final call. Here's the bottom line. You have earned your wisdom. You have earned the right to make informed decisions about your own body. Don't let fear push you into a surgery you don't need, and don't let fear hold you back from a surgery that could give you the next 10 active, independent years of your life. The difference between a good outcome and a devastating one often comes down to one thing: asking the right questions at the right time. If this video helped you, or if it made you think of someone you love, please share it. That share could genuinely change someone's life. Hit the subscribe button if you want more honest, research-backed health information for adults over 60. We're not here to sugarcoat things. We're here to give you the truth so you can live better, longer. I'll see you in the next one. Take care of yourself, because nobody else is going to do it for you.